Welcome to this week's show, When Your Health Matters, the show designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center. We're located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. Stopping into the office is always a good thing to do. If you do, you'll probably get a brief health evaluation as my gift to you just for stopping in and saying hello and introducing yourself to me and letting me know what your health concern is. But short of stopping into the office due to COVID and people's fears of picking things up in our current climate, you can always call me directly at area code 845-561-2225. Again, 845-561-2225. That is my cell phone. I'll be the one answering the phone. Please do not text that phone, as that phone does not receive texts and I'll never get back to you, which kind of defeats the purpose of you calling me. But if you do want to use the texting type mentality, you can always email me directly at docrick@spineboy.com. That's DOCRICK@spineboy.com. And whether you stop in, whether you call, or whether you email, it's my pleasure to help you to better understanding what the concerns you have regarding your health. This particular class is about your bladder and your bladder health. Your bladder being more than just a container, more than just a repository for your storage of urine before excreting. There are many different conditions, health conditions that affect the bladder, from bladder infections to bladder incontinence, to having a drop bladder or a very uncomfortable condition known as interstitial cystitis. These are things that people experience with regards to the health of their bladder, and I'd like to help you understand some of the things that go on in the bladder and what you can do to help yourself. If you ever have the increased frequency of urinating, typically at night or potentially during the day, whether it's wakes you from sleeping all the way through the night, you get up earlier than you should in order to have to urinate, or you find yourself throughout your day always needing to know where all the bathrooms are and spending lots of time going to the bathroom because you suffer from a bladder weakness of sorts. We want to make sure that this doesn't become more and more common in our society as it currently is. There's a interesting TV commercial. I haven't seen it in a little while, but there was an interesting TV commercial about bladder weaknesses and such, where it had a simulated human being made out of copper pipes walking around and trying to address their bladder weaknesses and their bladder control issues. And I just thought that the commercial itself was very entertaining, but I also felt that it was terrible that people suffer from bladder weakness and bladder control issues. So we want to get into understanding where those come from and why we have them. Emotional bladder stress. The emotions associated with the bladder. The chief emotion associated with bladder is a thing called paralyzed will. That's where you can't do the things that you want to do. We've been locked down in a pandemic for the better part of a year. I believe it's coming up on a year right now, and as of a year, we haven't been able to do things that we want to do the way that we want to do them. There's a mask mandate according to President Joe Biden for the first 100 days of his administration, which we're in the midst of right now. So we're all being asked to continue wearing masks. We're not able to travel freely. We're not able to interact the way that we normally would. So that's paralyzed will. So if there's an increase in the number of bladder issues that people are having, it has to do with the pandemic, I'm sure. Other than paralyzed will, we have the emotions of feeling miffed or confused. Timidity, people who are timid, a little bit unsure about how to proceed, people who are shy, inefficient, wishy-washy, or what the French would call as comme ci, comme ça, in reference to taking a whatever mentality and not really being committed or being in the situation fully participating. That's a lack of commitment, or feeling wishy-washy. And last but not least, what probably a lot of us are doing is a lot of contemplation. We're overthinking. We're trying to figure out, well, what's my next move? How do I deal with this? How do I deal with my finances? How do I deal with my family? How do I deal with my job? So a lot of people are dealing with all of that. So whether it's your relationship or whether it's your stress of the job, etc., or just really from COVID itself, you should continue to pay attention to that. Now, those bladder emotions dovetail well with the emotions of the kidney that we learned about last month, which is fear, dread, impending doom, meaning you're waiting for something else bad to happen, or remembering something bad, having a memory of something that was traumatic that happened to you in the past. Those things being active are going to create kidney bladder stress and create more stress on your bladder and potentially create bladder leakage problems and other bladder issues. Another reason for why people develop bladder issues, this is more common in women, and this has to do with those who have had C-sections, those who've had hysterectomies, have had their uterus removed. There's a ligament that supports the bladder and the uterus at the same time. And when you take the bladder out, when you take the uterus out, it's going to cause the bladder to sag. And so when the bladder sags, you get more of an urgency to need to urinate, or you may have the feeling that you can't void your bladder altogether, all the way. These are reasons associated with women and having hysterectomies. Same thing with women who are pregnant. The uterus sits right behind the bladder, and so when the uterus expands in an effort to allow the baby to grow inside, that's going to allow the belly to move forward and the growth of the uterus to move forward, which puts pressure on the bladder, causing a woman to need, when she's pregnant, to void her bladder significantly more than when she's not pregnant. And so it's important to appreciate that these things go on more with women than with men. Bladder infections. Bladder infections are not a fun thing to have. I've had several female patients who get bladder infections. They've developed chronic bladder infections, and then it's hard to bring them back into balance. But for a person who gets bladder infections and they're given antibiotics, the antibiotics may help to get rid of the infection, but unfortunately it also disrupts the flora within the bladder system, and that's going to potentially set you up for getting repeated bladder infections. So we want to make sure that that doesn't happen. If you're somebody who suffers with bladder infections, we want to be able to help you along with that. What else? Oh, the condition of interstitial cystitis. That's inflammation of the middle muscle layer of the bladder itself. Your bladder is a very unique organ. It has the ability to expand and contract with the muscles within the bladder. And when you get inflammation of that middle muscular layer, it's very uncomfortable. It hurts to urinate. It hurts to have your bladder be filled. So it hurts if you're coming or if you're going, which is quite uncomfortable. And that's the condition of interstitial cystitis. And I've helped quite a number of women over the years help with their interstitial cystitis. So if you're suffering with that condition, I certainly would like to have a consultation with you to help you understand what you can do. Now, what do we do? Solutions to all of these conditions have to do with the number one cause of health issues, which is nutritional deficiency diseases. That means that we're not getting the proper nutrients to allow our body to have all the ingredients it needs to continue to function at a normal rate. So people who get bladder issues, there's 2 supplements that we recommend specifically for bladder issues, regardless of what the bladder issue is, and that's a supplement called AC carbamide, and that's a supplement called Alboplex, and those need to be properly dosed if they're going to have the appropriate solution for the person. So you want to definitely be working with a trained healthcare professional such as myself that can help you appreciate if those 2 supplements are appropriate for you and are going to solve your situation, or if they're not appropriate. Something that a person can take in an effort to detoxify their genital urinary system related to their kidneys, their ureters, their bladder, and their urethra is a supplement called Arginex. That's very, very important. But again, you need to know that it's the right circumstance for you to take it under. So you need to have an evaluation. Just don't necessarily take it without knowing whether it's appropriate for you or not, because we certainly don't want you to create a bigger problem by not treating your condition appropriately. Last thing that people ask me about related to their bladder is cranberry juice. Is cranberry juice good for bladder infections? Well, it all depends. Is it a sugar-based cranberry juice, meaning that it's been concentrated and added sugar in an effort to create the sweetness so that you can drink it without it creating that bitterness in your mouth? Then that's probably not something that's going to help your bladder infection. It's probably going to feed your bladder infection. So the other thing that we want to be mindful of is the fact that if you are taking cranberry supplements, like a cranberry complex, which is an herbal supplement, then that can help with bladder infections, to help to acidify the urine, to help burn off any pathogens that may be growing within the urinary tract. So that's important. So what are some of the things that you should consider going forward? Well, we want you to consider the fact that if you have a bladder issue, how does that manifest? Well, it could manifest in symptoms related to your bladder, or the bladder meridian itself is the longest meridian or energy circuit within the body, and it slides all the way up your spine on both sides. So any kind of spinal imbalance, any kind of pelvic floor imbalance, these are things that are related to your bladder. Seeing a trained professional chiropractor who's well-versed in spinal alignments and understanding the relationship between spinal alignments and your bladder becomes vitally important. So if you don't currently have a chiropractor, you can certainly can consult with me, or I can help you find one local in your area so that you can get the kind of care that you need to help your bladder issues. If you have any bladder issues, please reach out to me. The best way to get a hold of me is to stop into the office. We're at 138 Canal Street in Pooler Park. Again, that's in Pooler, Georgia. You can call me directly at area code 845-561-2225, or you can email me directly at docrick@spineboy.com. So that's it for today's show with regards to the bladder. I appreciate you tuning in. I appreciate your questions and your feedback. Look forward to speaking to you again next week. But that's it for this week's show. So thank you very much for tuning in, and we'll be speaking with you again.